Bismillahirrahmanirrahim. Assalamu alaikum. Dear colleagues and PGs, uh, I have received many requests and wishes from many of you that I should talk about the ethics, professionalism, and humanity for doctors. So, in today's session, we shall discuss the ethics, professionalism, and humanity for doctors. But before we begin, I want you to imagine this. A patient walks into your clinic. He does not just carry a disease, he carries fear, trust, and hope. In that moment, you are not just a doctor, you are a listener, a guide, and sometimes the last thread between despair and relief. We all are mastered in anatomy, pathology, and pharmacology. But what about empathy, integrity, and humanity? The world may call us healthcare providers, but our patients call us something else. They call us their lifeline. Today, we are not here to talk about what medicine does to the body, but what medicine does for the soul of the patient and of the doctor. Bismillah ar-Rahman ar-Rahim. The practice of medicine is not merely a scientific pursuit. It is fundamentally a moral and humanistic one. Doctors hold a unique position of trust and responsibility in society. The triad of ethics, professionalism, and humanity forms the cornerstone of this noble profession. While medical knowledge evolves, these foundational values remain timeless, guiding clinical behavior, decision making, and doctor patient relationships. Today, we shall explore this foundational triad that defines the nobility of our profession: ethics, professionalism, and humanity. These are not abstract ideals, they are living values that must be embodied in our daily clinical practice. Let's move beyond theory and discuss how we can live these values every day in every patient encounter. Learning objectives of my lecture. After this lecture, you should be able to define and differentiate between ethics, professionalism, and humanity in medical practice. Apply the 4 ethical principles in everyday clinical decision making. Demonstrate key aspects of professional conduct in hospital and clinic settings. Incorporate compassionate and holistic care in patient interactions, and reflect on personal experiences to enhance moral awareness and empathy. So let's start with the section 1, that is medical ethics, the moral compass of medicine. Medical ethics refers to the set of moral principles that guide the practice of medicine. These principles provide a framework for resolving conflicts, making difficult choices, and ensuring that patient care is conducted with integrity. Medical ethics help us make morally sound decisions, especially when medical judgment alone is not enough. There are 4 core ethical principles. To understand these, let's have an example. A 60-year-old diabetic patient with chronic kidney disease refuses dialysis. As a doctor, you may know it could save his life, but ethically, you must respect his right to choose after explaining all options clearly. And this is called autonomy, respect for the patient's right to decide. And this is the first of the 4 core ethical principles. Let's have another example. In an emergency room, a confused elderly man is brought in. His sugar level is dangerously low. Even before getting consent from his family, you initiate dextrose therapy to save his life. That's beneficence in action. Beneficence means do good for the patient. And this is the second core ethical principle. Let's have another example. A patient demands unnecessary antibiotics for a viral illness. Ethically, you must refuse, even if it means disappointing them, because giving unnecessary drugs may cause resistance or harm. And this is called non-maleficence, do no harm. And this is the third core ethical principle. To understand the fourth one, let's have another example. You are in a government hospital with limited ICU beds. 2 patients need ventilation. Instead of personal preference, you make decisions based on clinical criteria and fairness. That's ethical justice. So the fourth core ethical principle is justice, fair and equitable care. So to summarize, the first core ethical principle is autonomy, respecting a patient's right to make their own informed decisions. Second is beneficence, do good for the patients, means acting in the best interest of the patient. Third principle is non-maleficence, do no harm. It means avoiding actions that could cause unnecessary injury or suffering. And the fourth principle is justice, fair and equitable care, means ensuring fairness in the distribution of healthcare resources and treatment. So these are the four core ethical principles you should have in your attitude, in your performance. Autonomy of the patient, beneficence, non-maleficence, and justice. The ethical dilemmas in practice. What are these? In my opinion, doctors often face complex ethical questions. For example, should life-sustaining treatment be continued in terminal illness? I have seen this as a very complex question. And you need a lot of care in answering this question. Second, how to balance truth-telling with hope. Again, this is a very complex ethical scenario. Third, to me, is when is it justified to breach confidentiality, for example, in contagious diseases. Again, it's a high ethical requirement in this scenario. So, ethical literacy helps physicians handle such dilemmas with sensitivity and fairness. Let's go to the second section, that is the professionalism. To me, this is the dignity of medical profession. Professionalism shapes how we behave, communicate, and carry the honor of our profession. Professionalism is the conduct, aims, and qualities that characterize a profession or professional person. In medicine, it reflects a commitment to competence, honesty, respect for others, accountability, integrity, and altruism. There are 5 core professional principles. We just learned the 4 core ethical principles. Here are the 5 core professional principles. To understand these, let's have an example. A junior doctor is treating a dengue patient in shock, but is unsure about fluid guidelines. Instead of guessing, he consults updated protocols or seniors. This is professional humility and responsibility. And this is called competence and lifelong learning. And this is the first core principles of professionalism. Another example: a popular actor visits your clinic with a mental health issue. You treat him respectfully and never share any detail, even with colleagues. That's professional confidentiality. And this is the second core principle of professionalism: confidentiality, protecting patient privacy. Now, the third example: a poor patient cannot afford an expensive investigation. Instead of ridicule or neglect, you offer cheaper alternatives and speak with empathy. Harsh language, even under pressure, is unprofessional. And this is the third core principle of professionalism: respectful communication. Let's have another example. You accidentally prescribe the wrong dose of insulin and realize the error. You promptly inform the team, correct the mistake, and report it. This builds trust and avoids harm. And this is the fourth core principles of professionalism: accountability and integrity. Now, another example. A pharmaceutical representative offers you a free trip for prescribing a specific drug. And this is very common. You politely decline and continue to prescribe only what is best for the patient. And this is called avoiding conflict of interest. And this is the fifth core principle of professionalism. So, to sum up, we learned the first core principle of professionalism is competence and lifelong learning. Means medical knowledge is dynamic. Continuous learning ensures that doctors provide the best evidence-based care. Then the second principle is confidentiality, protecting patients' privacy. Safeguarding patient information builds trust and respects privacy. The third principle is respectful communication. Doctors must communicate with clarity, compassion, and cultural sensitivity, not just to patients, but to colleagues and healthcare teams as well. The fourth principle: accountability and integrity. Physicians are answerable to patients, peers, institutions, and society. They must accept responsibility for their actions. Avoiding conflicts of interest means avoiding corruption, undue influence by pharmaceutical companies, or falsifying data or diagnosis. Now, the third section, the third component is that of humanity. And I call this the soul of medicine. Even perfect clinical skills lose meaning without compassion. Medicine is not just about curing disease, it is about healing people. Humanity in medicine emphasizes empathy, compassion, and seeing the patient as a whole person, not just as a set of symptoms. There are three core humanity principles. So you can remember 3, 4, 5. Three core principles of humanity, four core principles of ethics, and five core principles of professionalism. To understand the three core humanity principles, let's have an example. A young mother cries after learning about her breast cancer diagnosis. Instead of rushing out, you sit down, listen, place a hand gently on her shoulder, and offer hope. This moment stays in her memory forever. And this is the first principle of humanity, empathy. The empathy, not just treating, but feeling. Let's have another example. An elderly man with chronic pain also shows signs of depression. Rather than just giving painkillers, you ask about his social life, mental well being, and family support. You refer him to counseling. This means holistic approach. And this is the second core principles of humanity, healing the whole person. Let's have a third example. A terminally ill patient says, Dr. Saab, I'm scared of dying. You pause your routine, look into his eyes, and say, I'm here for you. That moment of human connection is more powerful than any medicine. And this is being present and listening, the third core principles of humanity. So to sum up, the first core principles of humanity is empathy, not just treating but feeling. Empathy means feeling with the patient rather than for them. It leads to better patient satisfaction and clinical outcomes. Regardless of age, gender, socio-economic status, or cultural background, every patient deserves to be treated with kindness and respect. Then comes the holistic approach, healing the whole person, considering a patient's emotional, psychological, social, and spiritual needs alongside physical treatment. And the third principle is being present and listening. Sometimes the most powerful intervention a doctor can make is to be present, listen deeply, and show genuine concern. Why this triad matters more than ever? This is a very important question. In the modern era of technology-driven medicine and commercialization, the doctor-patient relationship is under strain. Burnout, time constraints, litigation fears, and depersonalized care models have made it harder for doctors to maintain their ethical, professional, and humanistic standards. However, embracing these principles, 345, three principles of humanity, four principles of ethics, and five principles of professionalism, these leads to better clinical judgment, higher patient satisfaction, lower malpractice risk, and enhanced personal fulfillment for physicians. What are the common challenges doctors face? In my opinion, one challenge is time pressure in busy clinics. So the suggested response should be, what I think, that prioritize listening to at least one patient deeply daily. If you do this, with the passage of time, you will adopt the active listening and you will embark on the desirable principles of humanity, ethics, and professionalism. Another challenge to me is emotional burnout. And suggested response for such emotional burnout is that seek peer support and practice self-care. Another challenge, conflicts with administration or policies. And this is most of the times we face. So the suggested response, in my opinion, is advocate calmly, ethically for your patients. Another challenge to me is, and this is again a very serious one, it's anger or abuse from patients' attendants. And this happens off and on. Then patients become angry, or their attendants become angry, they become annoyed. So, suggested response in such cases is stay calm, involve security and support, and never retaliate. Another challenge is conflicts of interest arising from industry influence. And this is again a very big challenge. Suggested response is patient has the priority. Similarly, another challenge is the cultural and systemic biases that hinder equitable care. Again, my suggested response will be balance the situation. Last but not the least is the challenge is insufficient ethics training in medical education. And that's the reason I am having this lecture today in an attempt to educate our juniors, colleagues, our medical students, and my colleagues on this very important aspect. So we need to revisit the curriculum, the medical curriculum, and this is very, very important. So recommendations and the way forward, in my opinion, is ethics education, formal and continuous training in bioethics, and medical humanities must be an integral part of medical curricula. Then the role models and mentorship. Senior clinicians must model ethical, professional, and compassionate behavior for young doctors. The third recommendation, what in my opinion, is supportive work environment. Institutions should promote moral courage, provide counseling for burnout, and protect whistleblowers. And the other way forward is patient-centered systems. Healthcare should be organized in a way that respects patients' dignity and promotes shared decision making. So, the final take home messages in our today's discussion will be that knowledge heals the body. Knowledge heals the body. But humanity, ethics, and professionalism heal the soul. You are not just a prescriber or a technician. Remember, you are a healer, a guide, a human being helping another human being. I repeat, you are not just a prescriber or a technician. You are a healer, a guide, a human being helping another human being. Doctors play a vital role. In my opinion, doctors play a vital role in society, and their professionalism, ethics, and humanity are essential to providing high quality patient care. By embracing these values, doctors can build trust, improve health outcomes, and make a positive impact on their patients' lives. A personal reminder for every doctor. Wherever the art of medicine is loved, there is a love of humanity. By Hippocrates. Wherever the art of medicine is loved, there is a love of humanity. To cure sometimes, to relieve often, to comfort always. This timeless quote captures the essence of what it means to be a doctor. Ethics give us principles. Ethics give us principles. Professionalism gives us structure, while humanity gives us heart. Together, they ensure that medicine remains not just a science, but a sacred trust. The true healer is not just one who knows the body, but one who respects the soul behind it. In embracing ethics, professionalism, and humanity, doctors honor both the science and sanctity of their calling. Knowledge gives us power, ethics gives us purpose, humanity gives us meaning. So, I end with this. Have you faced an ethical dilemma recently? How did you handle it? And what would you do differently after today's discussion? Please share your experience in the comment sections below, and let's we keep this discussion going on. Thank you very much for listening. I tried to give you an overview of the 3 core principles of humanity, 4 principles of ethics, and 5 principles of professionalism. With this figure of 3, 4, 5, we can touch the real meaning of the medical practice. Remember, it's not the patient's symptoms. This is the patient as a whole who needs our attention, who must be respected, and who must be cared. Thank you very much. Before we end, let me leave you with this. Long after our prescriptions fade and our surgeries heal, patients remember not just what we did, but how we made them feel. Ethics is not a chapter in a textbook. It's a daily decision. Professionalism is not a dress code. It's the way we carry the weight of trust. Humanity is not an optional extra. It's the heartbeat of our profession. Let's not only save lives, let us honor them. Because in the end, the finest medicine we can offer is ourselves. It our most ethical, our most professional, and our most humane. Thank you. Khuda Hafiz.